Hello everyone and welcome back to MediInsights. Today we are going to explain Besifloxacin Eye Drop, why it is prescribed, how to use it safely, what side effects to watch for, and practical tips to help your eye recover quickly and comfortably in clear, simple language for patients and caregivers. First, we'll explain what Besifloxacin is used to do. Besifloxacin Eye Drop is an antibiotic medicine used to treat bacterial infections of the eye. It is commonly prescribed for bacterial conjunctivitis, which is also called pink eye, when the infection is caused by susceptible bacteria. The medicine works locally in the eye and is not intended for infections outside the eye or for viral or fungal eye infections. Doctors choose Besifloxacin when they suspect common bacterial strains like Staphylococcus or Streptococci are the cause, or when broad topical coverage is preferred. It is formulated as an ophthalmic suspension, so the drug stays mostly in the tear film and corneal surface where the bacteria are. Because Besifloxacin acts where it is applied, systemic side effects are uncommon, though local reactions can occur. Before prescribing, clinicians confirm the condition is bacterial and consider patient factors like contact lens use, pregnancy, and any known allergies. In many regions, Besifloxacin is reserved for topical use only, and its availability may depend on local approval and formulary decisions. It is important to follow the prescriber's diagnosis and not use antibiotics for viral conjunctivitis, because that will not help and can increase resistance. If symptoms are severe or worsen despite treatment, patients should return for reassessment, as guided treatment may be needed. Let's cover the usual dosing and any timing tips. Dosage of Besifloxacin Eye Drop depends on the specific product and the severity of the infection. For most commercially available Besifloxacin ophthalmic suspensions, the usual adult regimen is 1 drop in the affected eye or eyes 3 times a day for 7 days, unless the prescriber advises otherwise. Pediatric dosing follows similar topical schedules but must be confirmed with age and weight guidelines and a pediatric ophthalmologist when appropriate. Contact lens users should remove lenses before applying the drops and wait at least 15 minutes before reinserting lenses, unless the product is specifically labeled safe for use with lenses. If multiple topical eye medications are prescribed, allow at least 5 minutes between different drops to prevent washout and improve absorption. Patients should use the exact number of days recommended and complete the course even if symptoms improve earlier, unless instructed otherwise by the prescriber. If a dose is missed, apply it as soon as remembered, but do not double up drops to make up for a missed dose. Special care is required in pregnancy and breastfeeding, so discuss dosing with your healthcare provider if you are pregnant or nursing. Elderly patients usually follow standard topical dosing, but clinicians may adapt advice based on other eye conditions. Here's an easy explanation of the Besifloxacin's action. Besifloxacin is an antibiotic from the fluoroquinolone class that acts by inhibiting bacterial enzymes essential for DNA replication. Specifically, it targets bacterial DNA gyrase and topoisomerase 4, which are necessary to unwind and reseal DNA during replication and transcription. By blocking these enzymes, Besifloxacin prevents bacteria from copying their genetic material, which leads to DNA breaks and bacterial cell death or growth arrest. Because Besifloxacin is applied directly to the eye as a suspension, high local concentrations can be achieved at the ocular surface, improving activity against susceptible organisms. Laboratory tests show Besifloxacin has potent activity against many common gram-positive and gram-negative eye pathogens, though susceptibility patterns vary by region and time. Topical use limits systemic exposure, which reduces the risk of systemic adverse effects and drug interactions compared with oral or intravenous antibiotics. Resistance can develop when bacteria acquire mutations in the target enzymes or efflux mechanisms, so appropriate use is important to preserve effectiveness. Because Besifloxacin is specifically formulated for ocular application, Its delivery vehicle and particle size help maintain drug contact with the cornea and conjunctiva longer than simple aqueous solutions. This pharmacologic profile explains why topical besifloxacin is effective for many superficial bacterial eye infections when used according to recommendations. Besifloxacin can have side effects. Here are the common ones. Side effects of Besifloxacin Eye Drop are usually mild and limited to the treated eye, since systemic absorption is minimal. The most commonly reported local reactions include temporary burning or stinging on instillation, mild eye irritation, and increased tearing. Some patients notice a brief taste disturbance after applying drops, which results from drainage through the nasolacrimal duct into the throat. Allergic reactions are possible but uncommon, and may present as redness, swelling, itching, or more significant eye discomfort. If signs of an allergic reaction such as severe redness, hives, or breathing difficulty occur, stop the drops and seek urgent medical care. Patients who wear contact lenses should be cautious, because lens contamination or continued lens wear during active infection can worsen symptoms and delay recovery. Systemic side effects are rare, but if you experience unusual systemic symptoms while using the drops, inform your healthcare provider. Always report persistent or worsening eye pain, vision changes, or discharge that does not improve, as these may indicate treatment failure or a different diagnosis. If you are allergic to fluoroquinolines or have had severe reactions to eye drops, discuss alternatives with your prescriber before starting besifloxacin. Misuse can promote resistant bacteria quickly. And finally, don't forget these safety tips and warnings. Important advices for using Besifloxacin Eye Drop begin with following the prescription exactly as written by your healthcare provider. Wash your hands before and after applying the drops to reduce the risk of contamination and infection spread. Tilt your head back, pull down the lower eyelid to form a pouch, instill one drop, then gently close your eyes for about 1 minute to allow absorption. Avoid touching the dropper tip to your eye or any surface, as this can contaminate the bottle and lead to infection. If your doctor prescribes other eye medications, wait 5 minutes between different drops and apply ointments last if ordered. Do not use the drops more often than prescribed, because excess use will not improve results and may cause irritation. If you wear soft contact lenses, remove them before treatment and wait the recommended time before reinserting them, as lenses may be affected. Store the bottle according to the label and discard it after the recommended period once opened, because contamination risk increases over time. Tell your prescriber about any other medicines, eye conditions, or allergies you have, and mention if you are pregnant or breastfeeding. If symptoms do not improve within a few days, or if vision worsens, contact your healthcare provider for reassessment. Thanks for watching. If this video helped you, please subscribe to MediInsights and leave a comment below with your questions or experiences. And hit the notification bell so you do not miss future practical guides about medications and eye health.